Good morning, everyone. The topic for my podium presentation is comparison of a new monofocal and extended depth of focus intraocular lens after phacoemulsification. Nowadays, cataract surgery, it has become a refractive procedure rather than the visual rehabilitation because of improvement in the surgical techniques, including small incision and introduction of newer intraocular lens technologies. The extended depth of focus intraocular lens provides significantly, it increases the range of vision with minimal optical side effects of multifocality like halos and glares and aberrations. The extended depth of focus worked by creating a single elongated focal point to enhance the range of vision, that is from near to distance vision. They increase the depth of focus across a continuous range. This is the diagram showing the extended depth of focus. It has the optical diameter of 6 mm and a total overall diameter of 13 mm. It has an anterior aspheric surface and posterior achromatic diffractive surface. A newer generation of monofocal intraocular lens, that is Techniscience, it was launched in October 2019 in India. This monofocal IOL, it designed in such a way that it extends depth of focus from distance to intermediate vision to meet the patient's expectations. The aim of my study was to measure and compare the visual acuities and the contrast sensitivity between these two lenses. This was a prospective comparative and interventional study, and it evaluated 31 patients after implantation of Techniscience 15 patients, and I used the suprafoveal EDOF lens in 16 patients. Exclusion criteria were irregular corneal astigmatism, corneal dystrophy, pupillary abnormalities, history of any glaucoma, intraocular inflammation, and for intraoperative or post-operative complications. The uncorrected and corrected distance, intermediate, and near visual acuities are measured at post-op day 1, first week, 4th week, and 3 months. And contrast sensitivity, they were measured at 3 months post-operatively. This is the slit lamp retroillumination photo at post-op day 1. On the right side, on the left side is the extended depth of focus lens, and the left side is the Techniscience. The Techniscience and suprafoveal EDOF group, they were comparable with respect to all the preoperative parameters. And both the groups, they shows similar distance and intermediate vision, but near vision was significantly better in the extended depth of focus as compared to Techniscience at 3 months post-operatively. The uncorrected near visual acuity is what was better in the EDOF group. The incidence of halos and glares were not seen in the Techniscience, but they were present in few patients in the extended depth of focus, but they were statistically insignificant. The comparison of logMAR uncorrected distance and intermediate visual acuities and corrected distance and intermediate visual acuities as post-op day 1, first week, 4th week, and 3 months, they were same at all the time durations. And the uncorrected near visual acuity, which was better in the EDOF group, it was highly statistically significant. The comparison of contrast sensitivity, patient satisfaction, and the incidence of halos and glares within the groups shows no statistical significant distance, but it was present in 2 patients in the EDOF group. The Techniscience and suprafoveal EDOF, both were effective in improving the distance and intermediate vision, but near vision was significantly better in the EDOF group. Both groups retained good contrast sensitivity, and majority of patients they were satisfied. Thank you.
Had uniocular implantation or bilateral?
So in my study, they were uniocular. The patients, they were uniocularly implanted. Few patients for binocular implanted were not considered in the study.